Thank you everybody again so much for joining today. We're so excited to start our virtual office hours where we'll dive into the data and do a brief history. My name is Dana and I'm a research analyst with the team. In today's session, we'll do that history and give you a site walkthrough where we can dive into the data a little bit further. If you have any questions at any point, please put them in the chat. I'll end today's session with a Q&A where you can come off mute and we can answer your questions then. So let's get into it. Okay, so until now, rigorous and nonpartisan data on health and conditions that affect health on health have not been widely available at the congressional district level. We created the dashboard and launched it in January of 2023 to address this challenge. As its first-of-a-kind tool, our mission is to provide rigorous, accessible, and nonpartisan data on health and the conditions that affect health on a congressional district level. Our goal with the dashboard is to provide users with an array of actionable and nonpartisan data at that level to drive positive change at the district, state, and national level. Data itself can't change policy, but it's an important facet in doing so. Data can illuminate challenges and assets in communities that have otherwise been hidden. It can inform effective policy solutions, and it can be used to hold leaders accountable, really bringing into question if leaders are holding up to their commitments, priorities, and responsibilities. The data on our site can be used to provide that information that can support data-driven decision-making. We built this tool to be helpful for a wide audience. Think elected officials and their staff, advocates, journalists, researchers, and the general public, really anybody that has an interest in data on a congressional district level. Our team at NYU Grossman School of Medicine's Department of Population Health built a Congressional District Health Dashboard off the success off of our City Health Dashboard that was launched in 2018. Our partners include the Robert Wood Johnson Foundation, the Bipartisan Policy Center, and the Center on Budget and Policy Priorities. So what do we measure? That's the big question. So this slide shows all the measures we have on our site. We have a total of 37 metrics on health and the drivers of health, and they're divided into the 5 domains that you can see here. So as you can see, our first domain is the health outcomes domain, where you can, some metrics include breast cancer deaths and diabetes. For social and economic factors, some measures are broadband and children in poverty, and so on and so forth, you can see. Those that are shown with an asterisk indicate we have demographic breakdowns for them, and those shown with a triangle have census tract level data or neighborhood level data. The Congressional District Health Dashboard data was drawn from federal sources and other data sets that adhere to rigorous standards of data collection and analysis. These include the U.S. Census Bureau, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. All of our measures aim to be actionable and reflect public health priorities. Our team of population health and policy experts, epidemiologists, and geospatial specialists regularly update the site with new years of data as they become available and new measures across the 5 overarching domains. So I'll stop here and give time to check in for questions as we transition over to the site walkthrough. Hannah, is there anything in the chat or any questions that came up?
Thanks, Dana. Right now, we don't have any questions in the chat, but I'll keep monitoring it if folks want to put their questions in the chat.
Awesome. Thank you. And now we can dive right into the site walkthrough. So when you joined the Congressional District Health Dashboard, you were brought immediately to the landing page where you can enter in an address to find a district if you don't know what district you're in or what you're looking for, or if you can select specifically what district you're interested in. So in my case, let's say I am looking at the district that I'm working in, but through the zip code, but I don't know exactly where that is. So you can enter it in here and click on it, and it'll bring you to this page where you can click on View District, and then it brings you to a snapshot of that congressional district. So in this case, it's going to be New York's 12th district. This page gives a very brief overview of all the metrics that we have on it, and it includes all the information that you might need, including the domain that the metric is in, the estimate for New York State, the New York's 12th estimate, and the comparison on this side. So in an instance where you see the green circle, you can see that the New York 12th estimate is going to be better than the US average. In any case where you see a yellow triangle, that is when the congressional district is going to be around the same as the US average. And a red square will indicate instances where the congressional district estimate is going to be worse than the state national average. On this side here, you can see we have that overview, and you can actually filter by the domain of interest. So let's say I am looking for, let's just say, social and economic factors. I can click on that and it'll filter out for all of the metrics that fall under that domain. And keeping on with the same theme, if I wanted to look more into education, I could click on something like high school completion, because that might be helpful for me. I can see here that we have quick facts with the estimate, and that New York's 12th is doing better than the US average. I can click on the metric specifically, and it brings me to the next section of the site, which is the metric maps. So down here, you can see that all of this really shows up to your locality. You can also click on show census tracts to see how that metric looks within the district, but across that small level, that neighborhood level that you may be looking for. Wanting to call out and recognize that all of the measures on our site follow the same color scheme. So in instances where you see lighter colors, that will be better outcomes. For darker colors, that will be for when we have worse outcomes. The triangle here shows you that comparison of the US average and where that falls on the scale across all the dashboard. And the orange scale bar will be for the congressional district of interest. So you can see like some areas here are doing better than others, and some areas are kind of in the same ballpark in terms of how they're doing with high school completion. And you can also change this comparison value. So let's say you kind of want to look more granular and you want to look at how New York's 12th compares to New York State specifically. You can click on that and filter that, and it'll change based on what you selected. And now I have all this information about high school completion in New York's 12th, and I wanted to look a little bit more about how that does on a demographic level. I can click on this down here, and it brings me to the next section of the site, where you can see those breakdowns by sex and race and ethnicity in New York's 12th. So we include all of that information, and we include the sense-making statements below it, so you have a good understanding of what the data means. And then the last and new feature on our site is the Compare Districts site. So I can click on that and still stick with the same metric. Let's say I want to look at New York's 12, but I want to see how that compares to our other kind of districts in New York. I can filter that directly and look at New York's first. I can also look at New York as a state, and also look at the all of those comparisons are in these like cards below. You can see where the district is located and the measures on that. So that might be helpful for you and your work, specifically in terms of those comparisons. The last thing I wanted to highlight is our hammer menu, which includes access to the data. So all of our site's data is available for download for your use and further analysis. But that is pretty much all that I had for the site walkthrough. And I'll stop there. And so that really concludes today's session. We went through a brief history of the dashboard, and we went through a site walkthrough and dove a little bit into the data. You can feel free to stay in touch with us. We'll also send out a recording of this virtual office hours. We'll send the slides and also a brief survey so that we can connect further on these types of sessions.